11 officers in the Royal Virgin Islands Police Force can now function as first responders after completing a one-week course in emergency care and treatment at the Department of Disaster Management at McNamara in Tortola. Retired Staff Sergeant from Barbados Defence Force and current Emergency Technical Advisor in Training at PAHO WHO, Peter Burgess, told JTV News the trained officers will be equipped with life-saving skills.
In a mass casualty situation, or if there's a medical emergency, they could respond and provide viable first responder care until the more advanced medical personnel arrive. The course is a 40-hour course, and it involves looking at different types of trauma, mechanism of injury, head and facial injuries, abdominal and chest injuries. It also looks at soft tissue injuries such as lacerations, burns, musculoskeletal injuries like fractures of extremities, and it looks at some medical emergencies such as diabetic emergencies, heart attacks, seizures, asthmatic attacks, that kind of stuff. And what it involves is really a lot of theoretical aspects of it, learning what these injuries and signs and illnesses are, how to recognize them, and the basic medical treatment for them. It also involves where the participants learn how to stabilize a patient, do a proper patient assessment head to toe, find any deformities, contusions, burns, bruising, lacerations, that kind of stuff, and then how they would package that patient using a cervical collar, get them onto a backboard, and into an ambulance and off to hospital as quickly as possible.
The emergency care and treatment course is considered part of the emergency medical system and is certified by PAHO through various forms of assessments. Burgess, who has been part of the PAHO instructor team for more than 15 years and has taught the course in many other Caribbean islands, says the trained officers will be equipped to assist in times of emergency.
Most of our countries have limited ambulances and emergency response resources. So by having persons from all the emergency services trained, or have a cross-section of officers trained, what can happen is they can stabilize somebody until the professionals, which are the EMTs, arrive to do their stuff, like getting that patient on a backboard or extricating them from a vehicle. By having officers trained, they can actually control bleeding, which in turn will prevent that person from going into shock, and in that way they've saved a life. When the EMS personnel come, their job is limited, but they can take over then, and the officers can further assist them. Now, I would say you look at it in two ways. The officer might be there by himself, but let's say that the EMS personnel are there. There are only two of them. They need additional support. That officer is trained to give that assistance with limited effort.
The one-week course was organized by the DDM as part of its annual training program with support from PAHO. The course is designed to develop the officers' skills as first responders, specifically in the area of patient care and assessment at the scene of injury, illness, or catastrophe.